It's good to be here, my brother. I am telling you what a week we've had. And earlier this week, the CDC director made her announcement. And when she made the announcement, I saw on her face like a weight was lifted, because getting these children vaccinated is a big part of saving not only this country, but around the world from the pandemic. We cannot have unvaccinated humans. That's what the virus goes after, unvaccinated humans, no matter what age. And we finally have these kids eligible. They're in school. The numbers are coming down, but they're not coming down fast. And they have not come down to where we started at the beginning of Delta. So that's the challenge with this virus. We get the spikes, it comes down, but it never comes back to where we started, Omar. So we always have a new baseline that's higher. And as a result, we're almost getting numb to the number of people who have passed away. And many of those adults who have passed away are caregivers, parents. So when we look at the numbers of orphans, children that have lost a caregiver or a parent, both parents, many of them are Black and brown. So I'm so happy we have some pediatrician with us tonight in our regular clinical crew, and even some other guests. I'm going to let you introduce them.
Absolutely.
To help us deal with the mental health consequences, the stress, the anxiety that we're all feeling, and to help us get through as we get closer to the holidays and come together with family. So it's great to be here, and looking forward to a wonderful conversation this evening.
A lively conversation this evening. Yeah, let me introduce our guests, and we are elated, and that's an understatement, to have Dr. Mia Smith Bynum, who is with us again, and again she's going to help us to unpack the mental health of our children and how we process, really exposing our children to this notion of vaccinations, particularly when there's controversy within the community. They are hearing everything that the adults are hearing. And so the anxiety associated with the vaccination process can also hit them to a point of some mental challenges. And so we're going to have Dr. Bynum kind of help us understand and to identify those signs that our children may be experiencing a little bit more stress than they would ordinarily. And we also have a pediatrician, Dr. Catherine Jacobson. She's going to help us to understand from a medical perspective the safety and efficacy of the drug, particularly for 5 and up. The Pfizer has gotten emergency use authorization to now administer the vaccine for our 5-year-olds and up. And so we are going to unpack that as well. And again, we got our regular crew that's hanging out with us, Dr. Carol Ritter. She's always with us, and so she's going to help us kind of navigate this process. And we can't help but to go into the shop and go and hang out with Mr. Mike Dynamite Brown, and he's gonna help us understand what's happening on the streets and what the scuttlebug is in the shop. Yeah, that's scuttlebug. Have you heard that before? Yeah, and we got Katrina Randolph. She's doing her thing. They call her the short hair queen. She is she knows how to do hair. She specializes. If your hair is short, she's the best in the whole United States world kingdom for doing hair. And so she's my stylist as well. So so that lets you know she can do short hair.
Hey,
well,
Omar,
let's get it started. Mia, Dr. Mia Bynum, let's start with you. We talked about this before. We know that having this conversation about getting our children vaccinated in a world of disinformation, misinformation, rumors, innuendos, and all of that can be challenging. How do we now process, assess and process what's happening as it relates to getting a mass amount of people vaccinated that are children?
And that's really an excellent question, is that in the first phase of this, there was a lot of anxiety, like on the parts of the adults, and not really understanding the safety aspects of it. And then with the history, the history of medical treatment, medical access, it's a pretty rough one when it comes to people of color, particularly African Americans. And so I can definitely understand the anxiety around getting vaccinated. I think people should be talking to their physicians about it, and their children's pediatricians about this as well. If you trust your pediatrician and ask them for time to explain how the vaccines work and what the risks are, that can help allay some of the anxiety. I can imagine that some parents are still going to want to observe for themselves what happens in the larger country's context around vaccination. But I would say that we have to think about the consequences of not getting vaccinated at this point. Is that people are still acquiring COVID, they're still getting it. Kids are getting sick from it. And as Dr. Thomas mentioned, this is preventing a full reopening of the country. We've got to be thinking about risk for underlying medical conditions that children and adults have. And so if we just get down to the bare bones of it, really thinking about the fear, and you got to breathe through that fear. You got to take deep breaths and bring that body's reaction down while you're getting the shot and while you're listening to that health information. It's really important that you use reputable sources. And I know there's not a great history around that in the country, but then going to those trusted community members and healthcare providers, that's really the safest way.
You know, it's interesting, Dr. Bynum, for you to really unpack that and encapsulate it in such a concise way. I mean, that's just incredible. There has to be some background that gives you, you know, this kind of impetus to do this, the bona fides to do this. Tell us a little bit about you.
So I'm a child clinical psychologist by training. I do research on African-American kids and families, and I mostly focus on how do Black parents prepare their kids to cope with racism, and how do those strategies help mitigate any health impacts of racism. And so I spend a lot of time talking to parents, and even when I go to recruit them to be in my studies, I have to deal with that toxic history from the Tuskegee studies, so on and so forth. So I'm not injecting anybody with anything. I'm just giving you questionnaires, but that fear of the research is there, and it's justified in many respects. But I would ask that folks peel back the layers, because with the Tuskegee studies, it was about denying treatment that existed. Mm-hmm. This is treatment that is available and it's already covered by the federal government. And so those are two different kinds of situations. I'd ask folks to pull back the fear.
Yeah. And, you know, and although I know that it's commonly known, the Tuskegee study, but everybody know I'm going to say it's the United States Public Health Service study conducted in Tuskegee, not the Tuskegee study, because the Tuskegee people didn't do it, right? So.
Good point, touche.
That's how you know who knows. But
that's right, because
Mia,
you know, I'm the former mayor of Tuskegee, so I can say that, you know, and the descendants of 3 people who were in the study, right? So I kind of know about that study, and we'll talk a lot about that. And you are absolutely right. It was 1932 that the United States Public Health Service conducted a study on 623 men in Tuskegee, Macon County, Alabama. These men were told that they were going to be treated. They told that they would be fed and that they would get burial. Those were the 3 incentives that they had to recruit them into the study. The study lasted from 1932 to 1972. When 1947, when penicillin was made available, they denied the men penicillin to see what the long-term effects of syphilis was on the human body. Over 100 of those men died of syphilis complications. And of course, in 1972, Gene Heller wrote an article that exposed it. However, it was in medical journals the whole time. When it was exposed to the general public, that's when they ceased and stopped the study. And of course, as you know, history has presented itself where we were getting an apology from President Clinton and all of that. But the point of the matter is, this is not the same thing. They denied the men the treatment. With COVID-19, they're providing the treatment, two different concepts. And so it's important to put it in context. Dr. Bynum, you perfect on that. Thank you so much. Good. Let me hang out with Dr. Catherine Jacobson. She's a pediatrician, and want to welcome you to the Shots at the Shop orientation. And you know, this notion of giving babies and our children shots is not new. I remember when my daughter was born, we took her to the pediatrician, I think maybe a week or so after her birth, and they gave her a series of shots. And we had to authorize that, but we trusted the pediatrician. We knew that you know, she had done all of the studies, and that she had the credentials, and that she was knowing, she was a person who knew what was best for our child. And so we trusted her. I want to talk a little bit about trust in the medical industry now, and why is it that people are so distrustful in this instance where they've been trustful historically, Dr. Jacobson?
Well, thanks so much for asking that question. Thanks for having me here tonight. It's such an honor to be with you all. You know, there's, I think, a lot that has just kind of come down through the years from when we didn't have such access to social media and other things. And now there's been such an onslaught of information and the ability to kind of what they've called do your own research in a way, and also kind of the influence from some other places that's caused a lot more of kind of second guessing on some of those things. And so where people have had a lot of trust in the past, that some of that trust has been a little bit eroded. But I haven't seen anyone now second guessing any of those other ones. Sometimes people are asking now, wait, which shot is it? Where are we getting now? What one is that for? But, you know, I remember when I brought my son to get his 4-year-old vaccines, and we were riding in the car ride home, and he was saying, Mommy, what were all of those for? And I was explaining that to him, and he's like, what's diphtheria? And I'm explaining that to him, and I was like, well, do you want diphtheria? And he's like, oh no, I don't want diphtheria. What was tetanus? And I explained that to him. He's like, I don't want tetanus. You know, what's pertussis? I explained that. Oh, I don't want pertussis. You know, it's like, well, which one of those vaccine preventable illnesses do you want? It's like, well, I didn't want any of them. It's like, okay, well, you got your shots and now you don't have any of them. So you can be thankful for that. And so, you know, as I've been having the conversation with him, it's like, this is another opportunity to prevent something. And, you know, he got a cold not that long ago, and he was whining and complaining and miserable about it. And I said, you know, even the flu, when we brought him to get the flu shot, I said, the flu is much worse than the regular cold. If you're like this with a cold, you really don't want the flu. So how wonderful it is that we have the opportunity to protect you from that. And so I think that's the philosophy as we approach these vaccines, especially with these kids 5 to 11 who are old enough to start to have a conversation about it.
Mm-hmm. You know, I was talking to somebody before on the show, and he said there are only 2 things that saved mankind. One was the ability to purify water, and the second one was vaccines to protect us from severe illness through viruses. And I think that if we stop and think about it and get past the emotions attached to it and the disinformation, we've always taken vaccines. I know I recall growing up having vaccines regularly. So there's nothing new about getting vaccines to protect the public. And so, I guess we got to go back and kind of depoliticize this and go back to doctors and the people who know and trust them that it's in our best interest that we get vaccinated to protect ourselves against severe illness and death from this dreadful pandemic. And I think we need to do that. Dr. Jacobson, tell us a little bit about yourself.
Sure. Well, I have grown up and lived in the Baltimore area, and I now practice at the University of Maryland. I'm faculty at the School of Medicine, where I'm the Director of Medical Student Education for the Department of Family and Community Medicine. So I oversee the medical student education efforts for the department. So I have a lot of role in teaching the future doctors of America is really the crux of that role. So every time a patient comes to see me, 95% of the time I have a student with me. So they're helping to teach the future doctors, but I'm in the city of Baltimore practicing there where I've been several years now. I work a little bit with the resident doctors as well, but mostly with the medical students and seeing patients there in the city.
Well, we are so appreciative to have you hang out with us. Thank you so much for lending your expertise and your perspective, not just as a physician, but as a mother, right? That conversation with your son, I know resonates with a lot of people who are listening as well. And I think sometimes we forget that these same doctors and healthcare professionals, they have children as well. So they have to make those same decisions, right? And if you will get your child vaccinated, then certainly you have the confidence in the vaccine, because you would never do that if you did not. And so transferring that to people who may not have the knowledge that you have is so critically important. And so thank you for sharing with us on that. And we have Dr. Carol Ritter. Hey, Dr. Ritter, how you doing?
Unmute. I was like just sitting back and listening tonight, and I'm fine. I'm really good. I mean, it speaks to listening is really not something that doctors do all the time. A lot of times we just talk. So, and during this pandemic, there has been a real problem with messaging from the doctor's side of the world here. So it does help to have these conversations and just listen. So that's what I'm going to do tonight.
It's interesting. You said something very salient, Dr. Ritter, and that is messaging, because I think that we have not really spent as much time on getting the proper framing of the issue done right, and to tailor culturally to specific communities so that they will understand from their perspective that we're not a monolith. And of course, people are different, and we have different cultures, different language, right? Different ways of expressing ourselves in our different areas. And so we need to be mindful of how to get it where it resonates, believing that when people get proper information and understanding, they naturally gravitate to take care of themselves. And so you're right. We do need to listen. We need to first seek to understand and then to be understood. And so thank you for reminding me of that. Being a talk show host, I do a lot of talking as well. Dynamite Mike, man, let me tell you something, brother. I love you. And that, now when you get that sweater you got that set up, man, that just looks so real cool, man.
Thank you, man. I appreciate it.
Yeah. Tell us, what's the scutterbug, man? What's on the streets, man? Tell us what's happening. You just had a situation that happened. If you don't mind sharing it, I think it's important that, barbers and stylists are human too. They are knowing about friends and family members who are passing from COVID. And so you all are impacted as well. And you all are hearing, cases where people have family members to die from COVID in your shops. people are coming to get their hair cut for funerals, right? And stylists are, Katrina and all, are styling people's hair to go to funerals. And a lot of people are even styling people's hair in the funeral home because they did not get vaccinated. And that's a sad commentary as well. So let's talk a little bit about, the conversation on the streets. And then I'm going to go to Chris, because Chris Sherlock he's the man on the street. So he's going to kind of help us to understand what the conversation is on the street.
Well, the people who are still saying, no, I'm not getting vaccinated on the street, they still have a distrust for the system. Their mentality is, systems never helped me. They kept me in jail. They shoot us down the street, and all the atrocities to our race in the past, has an effect on their decision concerning the vaccine, because they believe it's by the white man. The white man did this, the white man did that. And when they're stuck in that stigmatism like that of how they're thinking and not letting their brain grow, they let the coronavirus chances of getting the coronavirus is higher and higher when you build that brick wall up. And it happened to a good friend of Fred, and mine's more so a friend to Fred than myself, but we all were buddies, but Fred had a relationship longer, and he was on the hell no wall. He wouldn't take the vaccine. And last week, he, I believe like Sunday or Monday, may have caught it, and by Thursday, he couldn't breathe, and they rushed him to the hospital. And when he got to the hospital, he refused the ventilator, and he died Saturday. And we got that news when we were on our way up to Baltimore to speak. And Fred was devastated. I was choked up myself as well, but it just gives you back to the harsh reality of what this thing can do to you and how quick it can do it to you. You just got to keep pushing through and push the message to get vaccinated, to save yourself and your loved ones, because I don't think in his wildest imaginations that he would have caught it, and then we're sitting here talking about him today. I mean, he's a good brother. He pop in, full of life.
How old was he?
Just unfortunate. He was like 56 or 57, I believe, around that late 50s.
Did he have kids he left behind?
He had nine kids he left behind. And his youngest was like 13. He cut his hair. He was always with his dad. Now his dad is not there with him anymore. I mean, that's got to be devastating. My heart just goes out to his family with prayers for strength. But concerning this issue about people not getting vaccinated, some people are going to have the heart of Pharaoh, and you're just not going to break them. They're going to have to be broken, and it's just sad and unfortunate that is close ones that you love and that's taking that position. And it just might be a chance that you'll be attending their funeral, and it's just sad, especially when it's preventable. It's very sad.
Right. And we all, I think more and more people are knowing, people that they know now who have either contracted COVID or who have succumbed to COVID now. And so now it's becoming real to people. Obviously, statistics sometimes cease to motivate people. How many, 700, we hit 750,000 people that died from COVID this week, right? That's a huge number. Dr. Osterholm said that if you were to call out everybody's name just in a pace, it would take you a year to call everybody's name 24/7 at 700,000 people. So if you think about this, if you just called everybody's name with just a little space between them, it would take you a year, 7 days a week, 24 hours a day.
Wow.
We start
Wow.
getting numb to those numbers over time, and that's why what
Right, and I
happens.
think that's what it is. We don't understand that, and people don't understand. You can contract COVID, and in 2 weeks you can be lying in a casket. That's how serious this is, and I don't want people to minimize it, and I don't want us to, because numbers are getting better, and hospitalization is going down, and the deaths are going down, that people let their guard down, because that's the same thing that happened before. And we don't want to do that. If you are unvaccinated, you are still as vulnerable. And even if you're vaccinated, you have to be careful, because there is a breakthrough cases. And we do know for those people who survive COVID, there's a long hauler effect. And Dr. Bynum, we're going to talk about the mental challenges according to long haul effects that I don't think a lot of people have even talked about. I'm going to Sherlock Holmes, Chris Sherlock. He's the man on the streets. Thanks so much, Dynamite, for sharing, man. I really do appreciate that. You're there listening to people, man. You're talking to people. You're really you're our eyes. You are our eyes and our ears for this show, and we want to let you know how much we appreciate you. We want to make sure that you're taking care of yourself as you internalize all of the trauma out there on the streets, right? So we want you to make sure you do that, because we love you too, man. Okay. All right, let's talk a little bit about what's happening on the street. What's Scott about?
Well, I'd like to say hello to everyone, and thanks for having me here. I'm glad we care. I just want to say that, because for everyone who thinks that they're forgotten about, they're a group of us, and I'm sure there are other pockets of individuals, but we care. And that's translated. That's translated through our actions. That's translated through our thoughts. And the anticipated needs to meet some of these disparities. Just recently, we stepped out into Prince George's County, and we're launching with 4 barbershops right now, soon to be 5. 2 of those that really stuck out to me, McGill's and Travers. For some reason, something just drew me to these barbershops and to these hair salons. Dr. Thomas, we were over at the Mona Center. He said, I want these shops. And he was adamant on recruiting these shops. And I felt the same energy. We walked the same street, we walked the same sidewalk to go into, to experience the same feeling, and something drew us toward that. And when I stepped in, and both of the Black barbers said, do you have any bilingual material? They thought about a completely different demographic, completely different set of people, even before they thought about themselves. And went a step further, Miss McGill, who owns McGill's, to let me know that there was a camp of homeless people in the area that needed to be outreach to. And was it possible to circulate some information toward them and get a head take for who does not, why? The homeless population, we care about everyone. And these are the moments that count. There's so many thoughts that are going through my head. Everyone that I've heard speak thus far has touched on a point that I wrote down on the paper, and I wrote it down and it came out their mouth. So I'm not mad that they took what I had written down. That just lets me know that we're all on the right page.
Yeah.
I just got confirmation from that, because Mayor Neal, when you mentioned 24 hours, that's what I have. You can't see it because the background, but that's what I have written down on my paper. And I got that 24 hours through a combination. It hit me today that the MMR studies a couple of years back, it consisted of 12 kids, 12 studies. If I'm not mistaken, that's how I understood. It was 12 candidates. And now we're talking about a group of 12 anti-vaxxers. So you add those 12, you add 12 and 12, and you get 24. That's how many hours that it's going to take to really combat this. We are up against a machine that hasn't even showed its face yet. And the good thing is that everyone is catching on. 5 and up vaccines. I'm here. I have a neighbor who stays next to me. His son has autism. We talked about the MMR. He said, you know what, it was hogwash. And I'm glad they did not have access to the social media and the media that they had back in those times, because it would be just as hard and we would still be fighting possibly MMR. So the fact that they're vaccinating five and up, bring it on. I'm going to get my son who has autism. He is 5 years old. I'm going to get my son vaccinated. That's the word. When you walk into the barbershop, these barbers and these stylists, they take it so serious. They don't even know that I'm coming, and I come in and they're completely masked up working. The information that we're disseminating into the community, their clients agree and they know most of it. So it's taking effect chip by chip. We're making a hit. And one last point. I was tasked with recruiting the barbers in Prince George's, Montgomery County, and Baltimore City. And on my initial hunt, I came across a barber. I'm not gonna throw any shops or names out. One of the most creative individuals that I could ever come across. Cannot wait to meet him. Hope that we have the chance to meet. He was supposed to start my November 1st vaccination. He's supposed to start my November 1st round that we just recruited to be. So he said, Chris, I want to throw my event around Thanksgiving. I want to bring the community up. Okay, I'll talk to you in September. I'll talk to you in November. All right, well, I'm not vaccinated. So, okay, well, I'm still for it. I want my people to be safe, but I just don't believe in it because I'm holistic. I'm going to stick with eating onions and turmeric.
I
reached out to him. Voicemail, straight to voicemail for the last 2 months. I've called, I continue to call straight to voicemail. I diligently pursued him. I went on Google Earth 2 days ago. I found his establishment. It had his number slapped on the outside of his sign. I called one of the barbers, answered the phone, and said he's been in Holy Cross for the last month as a long hauler. We can't even recruit him for the November slot that he wanted to promote the health in his community. And it hurts me because we actually build a rapport with each other. I was looking forward to meeting. There's nothing like seeing these faces and then feeling the energy in person.
Yeah. Let me tell you something, man. How many times have we heard where people were hesitant about getting vaccinated, and we end up hearing later on that either they passed or that they contracted COVID in ICU, being intubated or something. These cases are just piling up, these antidotes. And so what we need to do is we need to really sober up. And I agree with you, Chris. We got to do this 24/7. We cannot let up. We got to continue to have this conversation. Let me say also that we need to get a feel for how people are feeling. And we didn't do this early because we wanted to get people in and get them going. But I want to get a feel for how we're feeling. So let's go to the word cloud. Dr. T, tee it up.
Okay. So here's how this works. You're going to use your chat, and the question is this: what word best characterizes how you're feeling right now at this moment in the pandemic? It's going to be just one word, but as many words as you can come up with, just a word, comma, in the chat, and just put them in. We got a crew behind the scenes that are taking those words and building a cloud. So go ahead and start entering those words, and we'll keep the conversation going.
Yes.
And as the conversation goes, and as you see words in the chat that you resonate with, you can add that word too.
Right.
Sometimes the more people who use the same word, the bigger the word.
The bigger the word is. Right.
So
if you
right
think
now
about a word as we are going along, just add it in. Even if you put in your words, just continue to add your words in, so we can kind of see what how we're doing collectively. Now, Dynamite Mike, I know you got an event coming up, man. We got to do a shameless plug for your events.
And Omar, we had one there on November 1st. So I want him to reflect on what happened when we actually put needles
Okay,
in
okay,
arms
so you
on
just had
Monday.
one. Okay, go ahead.
Yeah.
So we had the vaccine clinic on Monday here. We had, I think it was about 15 arms that we got vaccinated that was saying no. So that was a nice chip away at the hell no wall. We got them the barber bucks, and they'll be back for the second round in 3 weeks, I believe.
Tell them about the barber bucks.
Barber bucks is a trip. When the barber buck is the fishing pole you want when you go fishing, because you're catching all types of stuff. So we're able to pull some people in that needed some help, and by them getting vaccinated, they was able to help the community as well. So it was a win-win.
I wanted Dr. Jacobson to know just some of the innovations coming out of the barbershops. It was Mike that actually came up with the idea of the barber buck. So it looks like an oversized bill. In this case, we were able to give $100 gift certificates for those who got vaccinated. And then they walk out in the streets under the bridges and they find folk who would otherwise never be vaccinated. And they showed up. And the other thing, Mike, about how was it working the streets, literally on the street corner?
The street corner, they got word up, and then they came. Y'all giving out $100? Oh yeah, yeah. I need to be vaccinated.
Whatever it takes.
Every arm counts. Every arm counts. So,
Yeah, one thing. But at some juncture, we're going to get to a point where the incentive is to be our brother's keeper.
There you go.
Right. We're going to have to get that. But in the meanwhile, in the between while, we need to save ourselves. Dr. Bynum, I want to bring you back on because this notion of understanding historical distrust, I think, is critically important, because there's some people, and I think it was Dynamite that said, why are you interested in doing something good for me now, when all of the other times you never did anything good for me? I cannot see anything that you've done that was in my best interest. Why are you now purporting to be in my best interest now, which is a legitimate position to have, or at least to consider, right? And so I think that, and we talk about it here because we need to be open and transparent, is that we don't need to just talk about, hesitancy or trustworthiness or people trusting. We need to talk about trustworthiness. How have we demonstrated that we are trustworthy, rather than just asking people to blanketly trust them? Talk a little bit about that.
When I heard it with the story that Mr. Dynamite Brown told, I heard multiple traumatic impacts. So every time this poor gentleman who passed encountered the system, he was encountering harm and abuse of some sort. And it's like that history is still harming people today, because they can't disentangle the vaccine effort from the historical trauma. Mm-hmm. And in terms of the efforts that I have seen be successful is when it's these trusted community members on the ground continuing to stay in the disinformation battle, because that's a piece of what it is. And I think having this program be available free on Facebook and on social media, where when people Google it, they can find true, accurate information, I think is really, really important. And so what's so traumatic and tragic about the way that these historical traumas work through racism is that even when there's a good effort, the previous ones are so bad that they overshadow the actual benefit from it. Like sometimes I wonder if the vaccines weren't free, if it worked in the ways that a lot of American healthcare typically does, would people's mindsets be different in terms of accessing it? But it's almost like a paradox, like by making it freely available, it plays into distrust, not only in Black communities and other communities of color, but in other communities that have great suspicion about the intentions of the federal government or other institutions. And so I think the providers have to connect with community members or be community members themselves. And then I think that the other piece too is, for some, I don't think this will work for everyone, is to help them make the connection that other communities are getting vaccinated at high rates. And if it's really bad for us, you would not see more privileged communities accessing them at the same rate. But it's interesting, the story that that Detective Sherlock has shared and Mr. Dynamite has shared. My sister's a nurse in a major city here in the country, and I'll keep the city anonymous, but the very same stories. People who come to the hospital, African-American patients, it's truly a pandemic of the unvaccinated. They are unable to breathe. In some cases, they refuse the ventilator, they refuse blood thinners, which, you know, COVID will sometimes cause the blood to clot and you can die of a complication. It's the very same things. It's a paradox of not wanting medical care, but they're not going to give you juices and berries in the hospital. So, you know, like they're going to give you medicine, right? And hopefully that medicine will work. But it's what I hear when I hear those stories. I hear a deep-seated fear of why all of a sudden is the government wanting me to get these vaccines, and not really thinking about the consequences of not getting it until it's too late.
You know, Dr. Jacobson, you know, we're asking you all to do things that you all don't really do a lot, which is asking you to come out into the community and talk about something like the pandemic. I mean, what you all want to do is just do your work, help set, you know, to treat people and to save lives and do all of that and just stay focused on your medicine. We're asking you to be, you know, public health specialists, you know. Now there's a difference between medicine, the therapeutic medicine, and public health. And I think a lot of times people conflate the two and they use them synonymously. Can you help us differentiate between the two?
Sure. Well, you know, it's interesting that you asked that because our department had changed their name a while ago to include community medicine in the title of the department, because they really wanted to emphasize that we don't want to just take care of the individuals walking through our door, that we do want to have an impact caring for our community as a whole. And we do, you know, we're an academic department, and we do have folks within our department who have as their area of focus the public health. And so they're trying to think about, how do we keep people well? And it's interesting in primary care, right? We're trying to keep people healthy, right? And where most of medicine is so disease focused, and we're in primary care trying to help prevent that and help keep people out of the hospital, right? Where most of our finances in the healthcare system are driven by, you know, billing based on, you know, how many procedures you do or how many medicines you give or that sort of thing. It's hard to quantify what do you save by how many vaccines you give. You know, when my whole family was, all the adults in my immediate family were vaccinated, my husband, my in-laws, my parents, my sister, her husband, everyone got vaccinated. When the first adults all got vaccinated, we said, which one of us was the one who got saved from the hospitalization? Which one of us was the one who might have died? You know, we don't know. And so it's a very interesting thing to kind of flip it on its head and say, from the public health perspective, when you're trying to care for the whole community, what are you benefiting? And, you know, Dynamite was talking about every arm counting, you know, and you all have been talking about, I forget you mentioned every human counting, right? You don't know which one was the one that you prevented. And so you're trying to reach everybody. And Dr. Bunyan's been talking about this relationship with the healthcare system, but also with the physicians in general. And Mayor Neal, you've mentioned that a little bit as you talked about bringing your child for vaccines. And I think that relationship is actually really important. And when people have that longitudinal relationship, the relationship that spans time with a primary care physician, it actually can be really meaningful, and it can be a place where people can go and can start to have questions answered and start to build trust. And we as physicians can start to try to build that trustworthiness, because if you trust me to help take care of that infection you got on your toe, or you trust me to take care of that pneumonia, or you trust me to take care of whatever else it was that came up, that ear infection, etc., then maybe when it comes time to talk about that vaccine, you might trust me to talk about that as well. And we can address specific questions. I haven't had a single patient all week who was vaccine eligible who didn't take it. I've had 100% this week. And I can only think of one in the last month who said no, and it was someone who wasn't my patient I was seeing for a colleague. And so they didn't know me. But when people have time to develop that relationship, I think it makes a huge difference. And so when we say the vaccine is safe and the vaccine is effective, and I took it for me and I signed up my kid, then that means something.
More is caught than is taught. People learn best by precept and example. You can't teach what you don't know, and you can't lead where you don't go. Right. And so that's what this is about. Dr. Sharon Cooper, hey, how you doing?
You're muted.
Good
Sharon.
evening.
There you go.
Good evening, everyone.
How you doing?
All is well. I just received my booster, so I'm just a little.
All right, let's snap on all of them.
Wonderful.
Congratulations.
Yes.
Yeah. We're talking about really, and what I want to do is we're going to bring up we got the word cloud, but I want to talk to Dr. Cooper before we start. Dr. Cooper, we're literally having to shift the paradigm. Dr. Jacobson said it, that we're going to have to do things differently. They're even changed the name of their department to include community, right? What you do is you literally are creating a cadre of people in the community to help respond to community health issues. Talk a little bit about that angle and how you believe how effective is that in getting people to understand the importance of vaccine uptake and saving their lives and the lives of their family.
Well, just to add to what Dr. Jacobson had said, and Dr. Bynum, we no longer can work in silence. It's the shift in paradigm, as you mentioned earlier. We have to take a collaborative approach. And part of that is connecting with the community and knowing and identifying those community needs. And we've had discussions, Dr. Thomas, Katrina, Mike, and Fred. I said, you can build a wonderful building, but if you're not connected with the community and you don't know who you're serving and what the needs are, then it becomes a moot point. So it's, again, value in what is being done through this initiative. It's a constant, and we talk about communication and that information sharing framework. It is imperative that we continue that work in that direction, because that's going to add value to being able to continuously address healthcare needs, whether it's COVID-19, whether it's hypertension or other comorbidities that are most prevalent in vulnerable populations. So again, this is innovative, this is needed, this is past due, this is something that, again, has sustainability. So we cannot revert back to the traditional model, which was, like you said, diseased model. And now we're in that preventive model. And especially when you look at the economics, the surrounding preventive health and moving forward. So yeah, definitely.
Yeah. Tell us a little bit about you, Dr. Cooper. We know you, but we're introducing you to a whole new audience.
Well, I am with the University of Maryland. I've been with the University of Maryland for over 20 years, and I was very blessed and privileged to meet Dr. Thomas at one of the public health forums that the School of Public Health was offering. That was the impetus for me to pursue a doctorate in healthcare administration with a focus on healthcare quality and analytics. And through that, I was able to conduct my practicum through the Center of Health Equity at the university, along with doing a study that looked at the value of the HAIR program and other community health workers in initiating and influencing better outcomes within the community, touching upon areas that traditional models of care were unsuccessful. So it was just a valuable experience, and I felt privileged to be able to speak with such individuals who were able to generate such insights and other knowledge that could contribute to not only improving practices, but identifying evidence-based practices that can be used on an ongoing basis in the future.
You know,
Well,
Omar,
we're elated to have you as a part of our team. We want you.
I'm blessed to be a part.
Absolutely,
and I feel privileged. Thank you.
Absolutely, yeah, absolutely. Hey, Dr. T, what's up?
let me just say that we have this continuum. We have Dr. Jacobson training the next generation of physicians that will be sensitive to the very issues we're talking about. We have Dr. Cooper, who literally did her dissertation on the barbershop work and has stayed with it. She was actually in Baltimore when we were doing our presentation and could see how that audience responded. She still hasn't left. And so it's another way of how you do scholarship that contributes to improving the quality of life in the community, and yet you don't leave the community, you stay with the community. So glad to have you here, Dr. Cooper.
Good. Let's see how we're feeling. What is our collective vibe, right? Let's
put that cloud up.
Let's bring up the word cloud. Looking hopeful, golly, relieved, right? History, determined, empowered, grateful, perseverance, fortitude, upset, change, distressed, disappointed, motivated, transformative, blessed, emotional, inspired, tearful. 1918. That was the last pandemic was in 1918. So I guess the remnants of the Spanish flu and stress. So people are dealing with a gamut of emotions, and it's important to understand that as we talk about these cases, like what Dynamite Mike said, was about losing a friend, a person that was vibrant, had full of life, 9 children, and now preparing to bury that person. That not only the breadwinner of the home, but the father of the children, that they no longer have a father. That's the human impact of this virus, and that's why it's so important that we take it seriously, because we don't want any of you to lose your life with what the CDC says is preventable. They said that every death, and I want everybody to listen to me, every death now, with very few exceptions, is a preventable death to COVID right now. And not only, Dr. Cooper said that she just got her booster shot, right? So not only do you get your shots, but you also get your booster shot to rev up your immune system even more so that you can fight against COVID. And that's critically important. So what we're doing is we're preparing our body to fight against something that's trying to kill us, and to not understand and appreciate that something is trying to save your lives and you rejecting that. That's something I know we got to deal with, the psychological thing about that. Dr. Bynum talks about it, but it's something about not trusting what over 200 million people have in this country have already gotten the shot. Over 200 million people. with very few, relatively speaking, incidents of any negative outcomes, right? And you are talking about you don't trust it. That's a conversation we need to have. And the other thing, and I think it's important to note this, is that families need to protect families. So we need to talk to brothers and sisters and cousins and uncles and aunts and grandmamas and grandfathers and whomever it is in our family, because we literally can be saving their lives. It was interesting that Dr. Cooper said, I don't know if it was Dr. Cooper, maybe it was Dr. Cooper that said, we don't know, no, it was Dr. Jacobson that said she didn't know who lives was saved by getting the vaccine. But it probably was somebody in that family that would have caught COVID and probably would have gotten seriously ill. We can't say that definitively, but it's possible. And that even could have died, that didn't die because everybody was vaccinated. That's a powerful message. And so we need to do that. So thank you all. You all can take the word cloud down now, and we can go back. Hey, Fred Spry, what's going on, man? Fred, as soon as I call him, then he goes out.
And I want you to know.
No, I'm here, big bro.
Hey, what's going on, man? How you doing?
Oh man, I'm trying to hold in there, man.
Well, my condolences in losing your friend, man. Dynamite told us about what happened.
Thank you, brother. Thank you, brother.
Does that even increase your resolve, Fred, to really address this issue on a broader level?
Well, let me just say this. It's like you're in a fight, and you just got knocked down. You're risking to lose it. So it's like, you recognize that it's serious. It's beyond serious. That's about as home as it can get for me. That's one of my real good friends, my partner with a nonprofit. I talk to him on a daily basis. I know his kids. He got a bunch of them. Mike know him. We go back 20 years plus, and it's like for him not to be here is a big deal. He's the last person I'd have thought of the COVID would have took out. He said he was gonna come to the shop and he'll make his mind up then, but he didn't make it. And so that made it to the point where I got to on the phone with people I know about vaccinated. I'm like, look, you got to take the vaccination. You have the choice no longer. I need you to take it. Take it for me. Take it for your family. Take it for everybody. And I told them about Lewis and how Lewis is gone. I still don't believe he did. I got the funeral's next Friday, and I'll see. Then it'll be real when I see it. But I cannot believe this guy's gone. Smart. He's very knowledgeable. Extremely knowledgeable. Very smart. But wasn't smart enough to take the shot, take the vaccine. And it's something real. I'm mourning. I see his family. They're mourning. And at the end of the day, it's like it could have been prevented. Because I know for sure if he had the vaccine, he'd be here today.
Yeah.
So like when you said a lot of people are here today because they didn't get the shot, because they did get the vaccine, I agree with you on that. They just don't know it. See, sometimes it's like if they don't know it, then it's like other people that didn't get a chance to see people die, they wouldn't have the opportunity to see how important it is. But unfortunately, we got the opportunity to see how important it is and how big of a deal it is to get vaccinated. It's stressful right here. I'm here, but I ain't here. You know what I mean?
Right.
Yeah, your body's here with us, but your mind's on the other side of town.
Yeah, I'm stressed. I want to go back in time. He had a birthday party 2 weeks ago. Him and Mario had the same birthday. Mario working a barbershop with us. So, me and Mike got on Mario real tough. Like, you got to take the shot. There's no choice right now. We're going to make you take it. And I wish I was like that with him. And he'd still be,
Yeah. And that's another thing too. Dr. Bynum, help us out with guilt.
You mean survivor's guilt?
Huh? Yeah, survivor's
guilt.
Yeah, let me tell you, let me give you a personal thing. I have a cousin who went to Florida to party. This was during the time that the virus was really, this was the first, not the Delta variant, but the first one. people were still in denial. This was maybe in April or May of the first year it came out, where, you know, it had not as bad as it eventually got. But he went to Florida to party. He came back home with COVID. He gave COVID to his mother and she died. Right? Can you imagine the guilt, the survivor's guilt that exists? Not because he didn't tell somebody to get vaccinated and was persistent. That's another kind of guilt. But when you know that you gave someone you love COVID and that they didn't survive it, that's another level of guilt. So I want to talk a little bit about guilt associated with this thing.
That so there's a phenomenon known as survivor's guilt, where really any situation in which the person feels that they should have suffered and lost their life alongside with a loved one or a friend, that's typically how it occurs. With COVID, that's like a trauma on top of a trauma, with the grief and the loss related to that. And I think too, with the messaging around it being preventable and the lapse in judgment about the risk, because I think a lot of this conversation is around people not understanding the gravity of the risk. And so we are still going through this, and we're a bit in a frozen in some ways, in that I don't think that as a country and as a community, we've absorbed the full impact of the loss of all of these Americans who died from this illness. But as we move to the 5-year mark and the reality of how many people we've lost, particularly people 55 years old, people with kids under 20, it is outside of the mind to really grasp the full scope of it. But that is going to start to sink in. And this survivor's guilt, this young person, I hope that they're getting some type of care. A lot of times people don't want to see a therapist for a lot of the same reasons that we're talking about, a lot of distrust issues.
Right.
But these are not the kinds of things that you just sort of bounce back from, that you do need support. I do wonder too about anger that other family members may have about this cousin, and the risk that they brought to the family's doorstep. And that has a ripple effect as well. And so there's a tremendous need for some type of healing there. And what I would say to this young person is I'm assuming that they survived the illness.
Yes, they did. They did. And there is ostracism on part of many of the family members. So it's like the circle closed back up with him outside of it.
So I think that young person needs to find ways to make meaning out of the tragedy. So how do you, because that's the only path forward, is how do you turn the tragedy into a lesson for others who can't wrap their mind around it? All of the stories that you all have disclosed here in this Facebook Live session, they pierce me. I'm a therapist, so I'm just softy. Like, I just feel a ton of empathy for all these stories, but to know that it's preventable. And I wonder, because the impacts are so disproportionate for Black and Brown communities, that it's another boomerang effect in terms of how much trauma will need to be processed as we move through this decade and come to grips with this pandemic. It really is a pandemic of the unvaccinated. It's a pandemic of disinformation. It's a pandemic of fear and loss. So it's layers on top of layers. And for the researchers who are out there watching, we need to be thinking about, like, how are we going to provide some type of intervention to help this collective loss, because the Black community is already dealing with a lot of threats to its well-being before the pandemic. This just compounds it in ways that I know I'm still trying to wrap my mind around myself.
You know, I'm
You know,
trying to help, and anybody can chime in on this. I'm trying to figure out, where does individual autonomy end and responsibility to the greater community begin? Is it selfish not to get vaccinated when we know we can infect someone, and not only can we die, but we can infect someone else, and they can very well have negative outcomes to the point of death, right? Is that a selfish thing? Is that a selfish, can we call that selfish if we know that to be the case?
If I may, let me weigh in with a concept I believe comes out of sociology and public policy. So I would, because I think if you go to people and say that they're selfish, that is not, that could be one way to frame it, but I don't think it's going to land right as a message to convince people to change their minds, right? Because that the individual choice is deeply embedded in American culture. Rebellion against the government goes back to the country's founding with the Revolutionary War. So these are multi-century norms. I think that a more useful way to think about it, when I talk with others about, is this notion of the public good. That the air is a public good, right? That no one owns the air quality, and yet this virus can circulate through the air. That the sense that you can go to a public place, the security that you can go to a public place, a restaurant, an amusement park, and be assured that certain things are going to happen. Norms that we take for granted, that we don't talk about it being selfish or not. It's like you get in line to wait for your turn to get on the ride. You get in line to catch a cab, like you put on your seatbelt. These are all things that are baked into American norms, and we don't say you're violating my freedom because I want to go to the front of the cashier's line first. We need to start talking about the public good and what is created when we all pull together. And I don't think that there's enough messaging around, if we take the Black community as one example, that our communities are a shared space. Our homes are a shared space. No one person owns the air quality, the streets, neighborhoods. That when you think about these ideas as being something that it only works if we all buy in, then I think you get away from this, you're violating my freedom, you're violating my individual choice, or you're more selfish, you're not as selfish. I think you have to tap into a shared sense of responsibility to the public good at large. And that can be a community, it can be a family, it can be a neighborhood, all of the above. But to get out of these individual notions, and to link it back to the fact that we're already doing it in these other ways, this is just one more way. And then, if I may, and I apologize, but I'm being full on
Dr. Bynum, you do you. You know how we do. Go ahead and do you. We go get to everybody. You know, we flowing. So just go on and flow. Do you.
If I could just have a conversation with you, former Mayor Neal. If someone who's more expert in it than me can talk about, because one of the myths that I hear is, or the concerns, is people say the vaccine was invented too fast. But for those of us who are trained researchers, we understand there was a certain amount of knowledge established before we had to have the push to develop the vaccine. And luckily, the science, the foundational pieces were already there to actually facilitate the acceleration of these vaccines. But I don't find that anyone's really explained the groundwork that was laid before the need for the big federal push and the infusion of cash, that we got lucky in that the science had been funded to the point where we were prepared to do something that was groundbreaking and life-saving. And that, no, it does not always happen that fast. But I think that I hear people say it happened too fast, which shows the public has some awareness that the science doesn't happen fast, right? That's not atypical. But what the public would not know is what preceded that, and why were we able to resolve that this quickly and get vaccines to market in under a year?
That's a wonderful segue into this. Dr. Jacobson, if you could unmute, and Dr. Ritter, you as well. I want to have a conversation with both of you concerning that because you really answered your question, Dr. Bynum, because you laid out exactly what transpired. Very different from what other vaccines and the length of time that it takes, because it was not, everybody didn't have all hands on deck on other vaccines. But let's go with you, Dr. Jacobson, and then Dr. Ritter, if you could kind of chime in.
Sure. That it's one of my favorite questions because, as a healthcare worker, we were essentially the first who were offered the vaccines when they first came out. And so I had a little bit of my own hesitancy. We'd been so excited and we'd been waiting for the vaccines. And people had been, praying for a safe and effective and widely available vaccine by the end of that year. And then all of a sudden it looked like it was going to happen and we were going to be first. And I thought, oh boy, do I really want it now? And we were very fortunate. Our director for Center for Vaccine Development came and spoke to the faculty as physicians to kind of explain to us and answer some of those questions. And so kind of what we're talking about here tonight is kind of trying to get the real information and try to find out what's really going on. We had the opportunity to do back then. And so I don't have her slides with me tonight. I wish I did, but the way she laid it out for us that night put me at such ease that I was able to say yes that night. And really what she explained was there were two things mainly. One was science and one was money. And then the third had something to do with attention, which I think you've kind of touched on, Dr. Bynum, with the kind of everybody dropping everything and focusing on it. But the first with science had to do with kind of what you're talking about, with kind of the science and groundwork being laid there. So people had been studying different SARS viruses. If you all remember, people might remember kind of some of the earlier SARS things that had come, would pop up here and there, and people would be concerned about those. So there have been some study that had been happening related to those, but some of the other scientific groundwork that had been laid was some of the genome work, like the genetic sequencing work. So if you remember, like the Human Genome Project many years ago, when that happened, right, that was major groundbreaking stuff, right? When people are like, we actually sequenced the genome, right? Doing all of that genetic work was very, very time consuming, and trying to figure out what the DNA for anything would take years. But that technology to be able to get someone's genetics is now quick and easy, right? Anybody can go online and you can go to, there's a number of different companies now, you can do a little cheek swab or something, and you or I could go get our own genetics. And so the ability for them to get the genetics for this virus was much, much easier than it was to get the genetics of a virus 10, 20 or so years ago. And so they had this virus sequenced in a matter of weeks, as opposed to a matter of years. And so that enabled them to jumpstart their work on getting the vaccine, because once they had the genetics for the virus, they were able to start working on the proteins and other parts that they would need to make the vaccine. So the scientific technology was their first step, and then some other pieces around the vaccine development and that sort of thing. And then the money, of course, right? So normally, if you're like, I have an idea, I'm going to make a vaccine against, right, say the common cold. You'll say, well, that's nice, but no one's ever done it before, and I don't know how that's going to go. I don't know how much money I want to give you for that, right? You have to start small, start doing little things and see how it goes, see if it works real well before you get some more money from other people. Here, everybody really, really wanted a vaccine, and they wanted it yesterday, and they wanted it to work really well. Right. And so a lot of money got thrown at this at the beginning so that people could just go full force right from the beginning. They didn't have to wait for step A to finish and say, oh, look, this worked really well. Now can we have more money for the next step? Now can we do this? They could just kind of go, 100 miles an hour right from the beginning. And then the second piece was all the attention, right? Everybody's saying, we'll drop everything and we will do it, and we'll do it now. And so all of the attention that was on it, both from the development standpoint, and then also from people being willing to volunteer, right? So there were a lot of people, and I'll tell you, we as humanity owe a huge debt of gratitude to those first volunteers who signed up for that, for those trials, who said, yeah, give it to me. I have no idea if it works. I have no idea what the side effects will be, because nobody's ever done it before. I remember the picture that I saw online of the person who was like the first person in the trial getting the shot in his arm. Bless them, because they took a huge risk for the rest of us as humanity, saying, I'll see. And the large numbers of people who signed up for those trials enabled them to run the trials very quickly. And then also the large amount of illness in our community meant that they could see very quickly whether or not it was working, right? If I, in the city of Baltimore, wanted to run a vaccine trial for malaria, you'd have no idea if it worked or not, because nobody's getting malaria in Baltimore right now. But there's a lot of COVID-19 going around, so they could see very quickly whether or not it worked. So those are some of the main reasons that they were able to do it so quickly, was really the financial resources that were put towards it, and also the scientific advances that led up to it, and then kind of the circumstances surrounding it with the volunteers and the attention and the state of the virus at the time. So Dr. Ritter, what other thoughts do you have?
Wow, you're amazing, Kate. I just love the way you describe that so thoroughly. You're just such a great educator and clinician. You completely covered it. The one thing that I want to point out from a historic aspect is that we can really thank Henrietta Lacks for the genome sequencing, because the HeLa cells were the first human gene that was sequenced. And it goes way back to that. So they were able to sequence the spike protein with no problem at all. But that historic fact, I think, is really prescient at this time, that we can thank her, even it was against her knowledge that they did that. But we have the benefit of her genes, and also that they took the competition away from healthcare. They took the competition away from the pharmaceutical companies. And what happened? They all went to the common good. And there we had all these vaccines so quickly, because they didn't have to worry about the money.
So Omar,
one of the things, go ahead, Dr.
Just very briefly, we had a nice little history there, and interesting enough, there's Black history in every step. The first person in the country was an African-American woman. The HeLa cell, thank you, Dr. Ritter. That's an African-American contribution. And Dr. Jacobson talked about the people who volunteered for the clinical studies. Guess what? Because of the legacy of the syphilis study, U.S. Public Health Service syphilis study done at Tuskegee, we have protections for human subjects, informed consent, do no harm, and making sure that people receive equitable access. All that linkage to our history is not lifted up enough. Thank you both. And it makes all the more the tragedy, Mayor Neal, that we got this vaccine in miracle time, and yet we have not been able to get it into the arms of the American people fast enough to keep this virus at bay. That's that public health infrastructure that we've got to focus on. And the barbers and stylists are now part of that new infrastructure.
And had we used as much enthusiasm about framing the issue at the same time we were developing the vaccine, we would have met in a more equitable space in terms of distribution. And we didn't do that. Now I want to make sure, because genome sequencing is one thing, DNA alteration is another. Differentiate for me with that, because people can hear genome sequencing. They say, what you doing to my genes, right? That kind of thing. And does that alter my DNA? So I don't want to, as the old lady say, I don't want to start no confusement here tonight. So let's just differentiate.
Yeah, thank you. Yes, we do want to differentiate those. So genome sequencing is just figuring out what is there already. And altering DNA is when you try to change what is there. And so the vaccine does not in any way change the DNA that is already in anyone's body. Your DNA stays the same. You stay you. I am still me after my vaccine. And everyone here who's been vaccinated is still them, still the same DNA in all of our cells, despite all of the vaccines that we've had. We're just have less of all of the vaccines all the diseases we've been vaccinated against. I have not only less COVID-19, but less tetanus and less diphtheria and less measles and mumps and all of the other things too. So it has not in any way affected my DNA.
I wanted to, sometimes I hear things and I say, well, that can be misinterpreted. So just for clarity purposes, we gotta just make sure we do that. Do you all know that we are about
Can you believe it?
7 minutes before we have to call it a day? That's how time flies, Dr. Cooper, Dr. Bynum, and Dr. Ritter, and Dr. Jacobson, and Sherlock Holmes, my man on the streets, and Dynamite Mike, and all. That's how it goes. And every week, you can find us here at Thursday at 7 o'clock Eastern Standard Time to 8:30. And that's going to be 6 o'clock to 7:30 Central Standard Time. And what we do is we come and we have this conversation, not trying to preach to anyone, right? We're trying to just understand it. And as we understand it together, maybe we can give you a little bit more confidence, the requisite information that you need to gravitate to take care of yourself. I want to end up with talking to Dr. Jacobson first about some takeaways. I know that I didn't ask you every question I should have asked you, and I apologize in advance for that. But now you have an opportunity to say what question I didn't ask you. Had I asked you, you had this great response for, right? So what do you want to leave the people with?
Well, I'm going to steal and take two thoughts, because once we were just talking about all this money that went towards the vaccine development, and the money didn't come out of thin air. It came from your pocket and mine. And so we've already paid for this vaccine. I know Dr. Runyon was talking about people being concerned that it was offered free, but it's not really free. We've paid for it. And so we now have the opportunity for something that we've already paid for. As my grandfather would say, get your money's worth. So we've already paid for it, and it's really something that's safe and effective. I've gotten it. My family members have gotten it, and I have an 8-year-old. He signed up for his vaccine tomorrow, and I'm covered in goosebumps even just saying that right now. I couldn't be more excited for him, because it opens up not only more opportunities for him to do more activities, as I'm going to let him do more things inside, have more play dates with more friends, but also it means that if he comes down with a cold or other things, I can be less worried about that. And means for kids in general, less missed time from school, and more time to be doing the things that they love doing. And so I had said my word was relieved, because I'm just so excited for my son and all of the other kids his age, these other school-age kids that are one more step closer to being back to what's called normal, which at this point is just such a great percentage of their lives. So thanks so much for having me tonight. I really, really appreciate it.
Dr. Kathleen Jacobson, you are an incredible person. I'm so happy to have had this opportunity to behold your countenance and to
thank you.
Just sit at your knee and learn from you. You're just an incredible person. Thank you so much for sharing with us tonight. Dr. Ritter, Dr. Carol Ritter, what's your takeaway? I know you've been in listening mode tonight, and obviously that's a good space to be.
Yeah.
So yeah, what's your thoughts?
Yeah, my thoughts are really, Chris, you said it when you started out, when you said, we care, this group cares. And that gives me hope, and that we are caring about our brothers and sisters. And part of that is being vaccinated and caring for our children who were really vulnerable. And that's how I get my patients who are not vaccinated, who say, I don't need it. I'm like, be generous. I mean, can you be generous to our children? Can you be generous to people that that you care about? So I love the fact that I'm here with a group of people who care. So thank you all very much.
And you are an incredible person and a valued member of our team. Thank you so much, Dr. Ritter, for all you do. We really appreciate you. Dynamite Mike, man. Again, my condolences go out to you and to Fred, and to all of the people who knew your friend, man. What's your takeaway tonight?
Let's just stay safe. Let's keep encouraging people to get vaccinated. It's like getting closer and closer to your doorstep. Being on the front line, you see the harsh reality and the devastation that it does to families, and it's kind of like I don't know how to put it. It's like you want to get mad at them for not taking the vaccine, and then they turn around and die, but then you feel sad and sorry for them at the same time. It's an emotional roller coaster, but it's not like a breakup with a girlfriend or something. You're talking about you're never gonna see this person again when they get it. So it hits a little harder when you kind of feel like defeated when somebody says no and then they die, especially when you know them. It messes with you a little bit, but we got to stay strong. I'm glad I got a good support with you guys. It's just we're all fighting the same fight, and it's just a little sad for me this week, seeing that we're gonna have to bury him next Friday. It's just a little sad for me. It's hitting a little home today, but we got to keep fighting.
Yeah, love you, man, and thank you so much for all you do, both seen and unseen, my brother. We love you.
I appreciate
so
it.
much.
Thank you.
Yeah. Dr. Sharon Cooper, your takeaway tonight.
So, same as what others have said, it's hope, it's caring and opportunities to bring about better outcomes and educating folks.
Thank you so much. You're a member of our team, so we're so happy to have you each and every time, Dr. Cooper. Thank you so much.
Well, thank you for adopting me.
Absolutely. Wonderful. Chris Sherlock Holmes, man, your takeaway for the night. We're going to try to make it short so we can get out on time. And I want Dr. Bynum, you on deck for right after Chris. Sure.
Sure, most definitely. My takeaway, the best things in life are given for free. They aren't free. The best things in life are given for free. There was a cost for it, for this vaccine. So I'm glad that was brought to our forefront. Somebody had to pay for the better of humanity. There were commercials a few years ago. They used to say, this thing costs this much, this thing costs this much, and this thing is priceless. And so I'd like to just break down just a few facts I looked up real quick. So the cost of an average hospital bed, $2,500. The cost of a ventilator, $50,000. The cost of your life, priceless.
Wow. Thank you so much, man. You're always profound in your salutation, and I really do appreciate you so much. A valued member of our team. Dr. Mia Smith Bynum, you're incredible. Your takeaway for tonight.
I don't know quite how to follow that, but I would just say that getting vaccinated is an act of love, and do it for the culture.
Absolutely. All right, thank you so much. Dr. T, it's on you.
I'm looking here at the word cloud, and I'm thinking back the conference in Baltimore, I see this tearful and inspired is in the word cloud. And while I feel the weight of Mike, Fred, Katrina losing their friend, when that hit them on the stage, it affected everybody in the audience and it inspired them. Their tears inspired them. These men, these are men's men who showed their emotion, literally transformed that room. And on the way back, as I'm driving Fred home from Baltimore, he gets on the phone and calls Mario. And this is what I'm talking to all the barbers and stylists here. He got on the phone and called Mario, and he shared his emotion and said, Mario, you got to get vaccinated on Monday. And Mario showed up on Monday and Mario got vaccinated. But we celebrated him. We photographed him. We lifted him up. And now Mario's going to do that for somebody else. Each one save one. That's where we are right now. That's my take home.
Thank you so much, Dr. T, and to all of you who participated in this wonderful exchange. It could not have been better, because if it was not for you, if it were not for you tonight, your spirit and your truth would not be shared. I believe that we are all possessors of some truth, and as we bring our truths together, then and only then do we get closer to the truth. And so I like to leave you with a short message of love. Love is leaving others very encouraged. And that's exactly what we have done tonight. You've encouraged me. We've encouraged each other to take care of ourselves, not just for ourselves, but for others. And that we are, in fact, our brother's keeper. As always, I'd like to leave you with these two words. Remember that I love you with a perfect love. But more importantly, remember this. You got the power. Until next week, same time, same station.
All right.
Have a wonderful day.
You
Bye-bye.
got the power, people. Go out and save somebody. Get on the
Bye-bye.
phone and bring somebody in who's not vaccinated. It's
Absolutely.
all right.